Hi, Peter. My name is Christina Caraballo, and I am the Vice President of Informatics at HIMSS. Within my portfolio, I have a number of things covering everything from cybersecurity to digital health transformation and interoperability to our clinical informatics. We've also got a really cool strategy arm to make sure we're staying on top of everything happening in the industry and in order to be able to advise our members and the broader community on their digital health transformation journey.
Awesome. I've been looking forward to this conversation all week, Christina, because the interoperability space is super interesting globally, but in Australia in particular, a lot of transformation happening at the moment, a lot of focus on standards and making sure the right information is going to the right places, and a lot of talk about HIE, all these things that I assume are kind of your world.
Yeah.
Is that right?
It is, and I joke that my passion has always been in interoperability. It's kind of where I started in my journey in health IT. It's actually in consumer engagement before it was cool, working on data standards to make sure that people have access to their health information, which has been really, really fun work to do. But yeah, I do a lot of work in the standards community. One thing that many people may not know, or some do, is we work closely with IG International, which is an organization that works on having testing events and building profiles so that we can implement technology more easily into the ecosystem. Recently, the Australian Digital Health Agency joined IHE International as a benefactor to help work with our tools and resources in order to get vendors really ready for implementing in the real world.
Yeah, well, that makes a lot of sense given the amount of focus we have on it back home in Australia. I'd love to understand, because I've had a lot of conversations here at HIMSS with a good mix of individuals, a lot from the vendor community, and quite often it comes up that an important part of what they're doing is that their platform or their solution or their services integrates in with all the different parts because, it takes a village and there's not one solution for everyone. If I was to think as them, and all this great work that HIMSS is doing, on standards and helping vendors create this, sometimes, what can happen is that when you're so deep in the weeds of building your own thing, you don't realize that you've got all this knowledge or insights or resources available to you. So what is it that's available to organizations that they can benefit from all the work that you're doing?
Yeah, and you said something really important, and it's about coming together as a community. We can't just build things for the sake of building them. I hate when we have standards that are super cool, or we build technology, but it's never used. So we have to work together as a community. That's one thing I love about HIMSS, is getting all of the people that touch IT together, where you're having conversations with the end users, the vendors, and the full community, so we can build solutions that are going to solve real world problems, which I think is essential. But when I think about the tools within the interoperability space and what we're doing within the Connectathon events and at HIMSS, we are really providing a place for vendors to be able to solve problems together. So we come with our community, we build the IHE profiles, which take the best of breed standards, put them into nice little packages, and I'm talking more simply and less technical, but put them into nice little packages so that vendors can actually test and bring their solutions to market. And then we have testing events around the world. Our biggest ones are in Europe and North America. We just actually had our first in Canada, in Toronto, which was really, really fun. But basically, you have vendors that are able to test with one another in real time. Right. And so this is really, really important because they're working out kinks so that when they actually go to implement in real world environments, there's less trouble, or they don't have as many issues because they've already done the testing. And I've talked to so many vendors on the floor that are doing the testing. They're like, we get so much done in 1 week that we wouldn't be able to do because you're really fixing things in real time, which is just absolutely amazing.
Hey, one thing I didn't mention before we spoke is that one of the many hats figurative hats I wear back home in Australia is on the board of the Medical Software Industry Association of Australia, and the work that the MSIA does is kind of advocating for the vendor community in navigating the ecosystem. A lot of that is trying to work with different bodies, whether it be government or also with standards, to then not just collaborate on the technical side, because there's a lot of value that comes from that in terms of, making sure these things work and all of the kind of technology bits work out. But technology is technology, and you can kind of, make that happen. Then you've got all the extra bits on top of it. So, if from back in Australia, it's one thing for, an authoritative body to say, hey, we need to build to standards because this is where we're going. But, every decision that a vendor makes, that's an investment in people and time and potentially technical debt as well, because, they don't want to go down one particular path of doing something. And then it's like, oh, hey, by the way, we're not doing that anymore, or like we need to build it to this standard. And then you've got all the other elements of, in healthcare, there's a lot of human mushiness that's involved as well in terms of clinician requirements and the adoption and all these kind of bits. So where do you see, there's a lot of work we can do in standards to make the technology work, but then there's all this other stuff on top of it in terms of aligning with federal bodies and engagement with clinicians. All this, how do you kind of reconcile all this kind of stuff? Noting that we only have a couple of minutes.
Yes. No. And and that's a great question. And I think that's where you have to communicate together, right? Yeah. So we have to have these really transparent, open communication paths that we're talking to one another so that we can bring in the governments, we can bring in the hospitals, we can bring in the vendors, and we can have conversations on what's needed. It's often not only a technology problem too when implementing technology into the world. It's often culture or regulations or practices. And so we've got to solve those things too as well. So I often say, well, the technology's ready, but we're still trying to create the connected ecosystem. So, that really becomes where it's important with standards though, so that when we're ready to kind of really connect into different areas, we've got the path to do it. I'm really looking forward to the full digital health transformation that we're undergoing right now, where we're going beyond just hospital systems and thinking about the other places where we live, eat, work, and play. Also incorporating things like community-based organizations into the ecosystem, looking at the long-term post-acute care communities, looking at the emergency medical systems. Imagine if our whole ecosystem could just interconnect. And I'm thinking as we go through on a global digital health transformation, which is my new favorite word, or cluster of words, I'm really looking forward to see how we all progress together. And I love the communities that are coming together. Big thing to look at right now within the global community is development on the International Patient Summary, where so many countries are coming together right now to figure out what are those basic data elements that we need. And how do we share them across our borders and regions?
Christina, we definitely need to have more of these conversations in the future because we could do that for a lot longer. But lastly in this chat, HIMSS 25, we're rounding out another great event. Interoperability featured a lot on a lot of the sessions. I didn't get to jump into all of them or anything, but what are you seeing on the floor in speaking with vendors as we kind of close out this conversation, the trickiest challenges to address, or perhaps even some advice to those that are trying to navigate this labyrinth of information that's available and the problems to solve in the interoperability space, and tying in with the why, what are we actually trying to achieve?
Yeah, that's a great question. And one thing that I've been thinking about a lot is understanding where each of the different people within the healthcare ecosystem are on their digital journey, because there's such a disparity between many of the larger healthcare systems that are very ready for things like artificial intelligence, and then the rest of the world where they're maybe at the beginning of their digital health journey. And I think that when we look at the full ecosystem that I've talked about, we need to map out where each organization is on that journey so that we can help everyone kind of get there together.